So, as I was saying in my previous video, when my mother used to fast, she had a separate set of for fasting separate utensils where her water and food used to be cooked and stored. And because she had a whole separate water supply, it was very easy for someone who has this criminal intent to, cause harm to someone to pour those meds that he has had access to. And I'm not saying that he denied treatment or pilfered the drugs from my grandmother while she was undergoing treatment. It is potentially possible he did that. Now, this can only be confirmed by someone who might have known what was her therapy at that time. That can only be confirmed with those families who knew what was her therapy if they had gone to the doctor while her treatment related, because I know some cousins had helped with her caretaking as well in our home. So if they knew what was the therapy suggested, and if people communicate with each other what was going on when she was undergoing the treatment in our home or post treatment in other people's homes, what was going on with her pain level, pain threshold, then the right answer could be gauged about her. Now, while that is one place where someone with antisocial personality, and I'm not saying that this is exactly definitely what happened with my grandmother, that I have no proof about, but I do have an intuitive understanding that it is possible that my mother's drowsiness post my grandmother's death, which had escalated only after my grandmother's death, a year or a few months after my grandmother's death, is when my mother stopped rising early in the morning to feed us, to take care of us, to pack our lunches for school. And we had early morning classes at that time. But for 3-4 years prior to that, she had always gotten up early to make our meals. But from the post my grandmother's death time, my mother was a little belated in waking up early in the morning. So at that time, so this part was definitely true, that my mother was likely waking up groggy in the morning. Likely, that's why if she is getting drugged from some source, she's likely going to be less likely to wake up at the same normal hours that she used to wake up. Like she was possibly waking up earlier. I never saw my mother wake up early in the morning or gauged what time she was waking up. But if for getting ready for school, I am waking up around 6:45, 7 o'clock, and my mother had to wake up before that to pack my lunches, or at least around the same time that while I'm taking a shower, packing my books, because this is a practice that I used to do as a teenager. I used to pack my own books. My brother also used to do this. We used to pack our own books for school, and we used to take a shower. If we had time to eat something, we might eat something, but most days my practice since teenage years has been to have meals only during the 10 o'clock 10:30 school break that we had. So but that break time meal was always prepared by my mother. So those meals, at least some of them were 15-minute packing was needed. So she was either waking up around the same time as us or slightly earlier than us to help us to ensure that we get the meals that we used to have with us when we went to school. But after my grandmother's death, she wasn't able to wake up, and after we came from school, usually around 1:30, she was also getting a little delayed in preparing lunch for us. So at those moments of time, my dad started pushing the narrative that my mother is depressed or she needs depression medications. And again, this is also another toxic mental illness called Munchausen's by proxy, where they want to continuously have a sick person in their life so that they can gauge, get sympathy, empathy, and access to medication. Now, I believe he had a couple of combination of mental illnesses. He's not just, and social illnesses. He's not just he doesn't simply fall in only one of these categories, because this was a consistent pattern he had in his life. And this much I can say, that he had chances of drugging my mother were extremely high. For the potential of my father doing that was high during the time my mother was extremely groggy in the early mornings. Then secondly, in the case of any patient whose medication is now getting diverted by someone, this is something pharmacists, lawmakers, doctors, prescribing something to a patient, people wanting to change the system related to drug abuse, drug misuse, drug manufacturing related issues, earth pollution related issues. All of us have to wake up to this element related to drug usage and drug misuse and drug diversion and drugs used for killing someone, because these are all potential places. If you get away with slowly drugging someone, and then you can also get away with using those drugs to kill someone as well. And I do have relevant logical grounds to suspect that my dad has been a serial offender like this for many years, for many people in my family, using many ways, some related to drug usages and some related to other substances that he consciously knew are toxic for consumption if given in the wrong manner to the wrong patient. And even though he was not a medical student, he was an engineer, he has a high IQ, and because he has a high IQ, and I believe he had hopes of entering some medical school when he was younger, so he was also a very good student as well in childhood days. And he also had access to medical books because of me and my brother studying it. He is also very a well informed person, so he reads a lot, so he had access to books in the libraries of his friends' homes or libraries in his own work environment, where research work related to both engineering and medical field were being done in his workplace. So he is a very knowledgeable person, and he is not only a knowledgeable person, he knows effectively how to use that knowledge as well for many things. So if and not just like him, there are many people there who may be just a simple technician to a pharmacist to a doctor to a nurse, who can have access to these drugs and who can manipulate the system or fudge certain things in the system to now divert drugs that should technically have been given to a patient, but they are not administering it to a patient. Because this is something because I was working in hospital IT, and I worked in as an intern. I have observationally seen all the operational structure of how a particular hospital works when I was interning there. So, and I'm very operations oriented, analytical mindset oriented. So both of these were my areas that I was looking at when I was looking at the data related to the and at that point of time I had this interest in I got a topic also to discuss in one of the themes I discussed in my MBA class was related to medical wastage. But the same thing that can the same topics that can lead to medical wastage in a hospital is also the same, or a hospital or a long-term healthcare facility, or when patients are over medicating or buying medications at a faster rate because of IT and tech related challenges. I don't know how to explain this whole thing. This is also a whole gamut of topic that I can discuss for at least 3-4 hours separately on each of these topics that I want to address. But the thing is, there are multiple places where people have chances to divert drugs, illegally get access to drugs, pretend that the drug is actually going to a patient when the drug is not going, use the loopholes in the system to create medical waste, and then use those medicines for illegal personal gain or illegal sales of those drugs. And these things are common. It does happen. I had access to also observationally as a patient in a pharmacy, as a person dispensing drugs to a patient in a community pharmacy setting, where in community pharmacies the patient population who are very drug dependent or drug diversion related work doing criminal types. I had that analysis and understanding of those patients also who are just simply getting over dependent on their medications, as well as those patients who didn't have good intentions towards their spouses, but were picking up medications for their spouses, as well as those patients who were potentially not using the medications they are buying from us for their use, and are possibly using it for drug diversion related purposes. Now, while I suspected all these patients without actual proof or really strong proof, reporting these people could be a problem zone. But that doesn't mean that intuitively the honing of understanding of the patterns and behavioral patterns of those patients I can't pick up. And why do you think I picked it up? Possibly the past things that happened in my childhood, in teenage years in India, with my mother, with my grandmother, and other family members also, who I believe had been impacted health wise via this same person's other health challenge adding tactics in their lives. So I potentially feel my father has had many past victims in the past with whom he has done some deliberate malicious harm to their health, and his harm related steps had indeed led to eventually there was one of the factors responsible for their death as well. But it can only be investigated in the right way when even now I believe some of these, because of earth pollution related now issues, if a person, people don't realize it, but if I live in this house and in this building there are how many units? I think there are 12 or 16 units in this building, and just in this one structure of this building. So now in 12 families, if 12 families use even 12 different kinds of drugs for each family members, some health issue or the other, and over 10 years of time or 5 years of time people have been using different kinds of drugs in this locality, what is going to happen in our sewage system of this building? In our sewage system, the metabolites of the drug is going to be present in our sewage system, and if there are any cross contamination now with the sewage systems, pipelines and water supply pipelines, I can also potentially have that water supply now have those drugs that are prevalently and commonly used in this area. And it's not simply about just the members of the people living in this building using certain kinds of drugs. If I live in a big large city with 10,000 population, 100,000 population, 1 million population, doesn't matter how much the population is, but what matters is what is the pattern of drug usage in that area. This is something I experienced in Utah. At that time I didn't understand this is why I was getting this health issue, but I had this consistent health issue that every time I would visit India for vacation with my family, and my usual vacation times used to be about 3.5 to 4 weeks in India. And after spending 3.5 to 4 weeks in India, by 3.5 4 weeks, what is happening? Whatever water and food exposure and drugs that might be present inadvertently in my local water supply that I have consumed, I don't know that water pollution parameters were existing at that time. My awareness level of water pollution was not there at that time. Just like me, like everyone else who doesn't understand how water pollution and water contamination with drugs work. Most of us do not have this understanding. But or we don't think too carefully about it because we have not put the 2 and 2 together until now. But now is the time for people to wake up, to put this 2 and 2 together about how water pollution can happen from drug or chemical usages in a particular area. So if in Utah, and I know in Utah there was this prescription drug problem of pain medications only that patients used to overuse because of the pain they are experiencing and other health challenges and life challenges they are experiencing. So because Utah did have this chronic, this was a studied thing in Utah healthcare, that prescription drugs related to narcotic drugs usage was increasing decidedly over the years in Utah. At a time, while that increase of drug usage was happening, what started happening was I had visited India at least 4-5 times during my 13 years of while living in US. So in all those years that I have visited India, first few years I didn't experience this problem. But after in the somewhere around my late 20s and early 30s when I visited India and I went back to Utah, at that time what was happening with me was I was getting constipation problems every time I was going back to Utah. And at that time I thought maybe some reverse, while people usually when they're traveling from Western countries and developed countries to India, they have what problem related to water pollution. When we come to India, people know that there could be microbial contaminations, parasitic contaminations in our water supply, and as a result of which people are either getting given prescriptions to help with their anti-parasitic drugs, anti-malarial drugs, microbial drugs. These are all prescribed to a patient. Some patients also take some injections against or vaccines against certain things as preventative measures. So like that, people when they are traveling from Utah or America to Africa or Asia, at that time certain protocols are followed when they are traveling, international travelers, and they're going to travel to a foreign country for a while. So at that time, why? Because it's a common thing. People, when you are traveling from US to India, you can experience as a result of microbial contamination, parasitic contamination in the water, you can have stomach upset related issues, diarrhea related health issues stemming from the microbes changes in our water supply, parasitic changes in our water supply. So what I assumed when I was a 20-year-old, 30-year-old, I assumed that it is possible that the reason why I'm getting the constipation is because of this opposite shift, that while in India I'm getting used to the microbes in India, so my gut bacteria levels are now used to Indian microbes. And in US, because those microbes are not present in US, my gut doesn't have those bacteria to generate the poop, and as a result I'm getting the constipation possibly, right? So reverse diarrhea syndrome was happening is what I assumed. But now I'm realizing it is also potentially possible that if in the city where I'm living in, there are hundreds of prescriptions being dispensed, thousands of prescriptions being dispensed of narcotic drugs that have the side effect of giving you constipation. And not just narcotic drugs, there are many drugs that have the potential to give you a constipation as a side effect. Right? So if all of those multiple drugs are being used in large amounts in a particular area or particular area where from my water supply is coming at that time, or if cross-contamination again in water supply has happened in my home as well, either of these scenarios will ensure that some narcotics might be there in my water supply. The narcotics that I'm probably using while cooking my food and drinking my water, and our normal filtration systems have the capacity to filter out what? Any filtration jugs that I used to use in Utah, they are microfiltration devices. So those microfilters are going to filter out particulate matter in the water, right? It's some particulate kind of things. So any microbes which are of a particular size might get filtered out. Any chemicals that are of a particular size might get filtered out. But if there are any chemicals which are smaller in size than the filtration device's filtering capacity, at that point of time, I would still end up consuming some of the water contaminants, right? And similarly, and most of us, we usually directly use the water from the taps for cooking. Very few of us in the past have used filtration devices to filter the water for our cooking globally. And because most of our knowledge about water pollution related health issues has been under the assumption that most of the water pollution related health challenges related to diarrhea or something that people get happens when there's microbes or parasites in the food or water, and if we boil the water or food, those microbes and parasites will die. And that's why if enough boiling has happened in our cooking, we are safe, or high temperature cooking has happened, we are safe. So if you've been cooking in an oven at a high temperature, or you've been boiling your food in water for a while, you are safe to consume that water-based soups and drinks that you're cooking, or any other thing you're cooking in the oven, right? That is the general assumption. But this is another area where people need to wake up, that it is not always the microbes in water that impact your health. Other than microbes, there are chemicals also in the water that can impact your health. There are heavy metals in your water that can impact your health. And if the filtration device that you are using for filtering out the water, or if you don't filter the water in all elements of using the water, in those areas it will impact your health. So while cooking in Utah, while drinking the water, it is stored in a jug with a filtration system. I am drinking water which is filtering out some contaminations from it. But will it still filter out all the chemical contaminations? No, because many chemicals are very, very microparticle, nanoparticle like chemicals. So that as a result, they may not get filtered out efficiently by the simple filtration systems. Secondly, if people, local authorities that are supplying your community water supply are not aware that your locality's chemical usages, drug usages are polluting your water with chemical contaminations, and your filtration systems are systems of maybe 20 years back, 50 years back designing, again they are not going to be able to filter out all the chemical contaminations in your water. So invariably, many of us actually currently in the modern world have exposure to water pollution elements despite whatever filtration system we are using. The ones who use the best kind of filtration system, or filtration system that is able to filter out 80-90% of the contaminations in their water supply, they may have, that's why, better health than ones who are using filtration systems which are based on old school paradigms, and that's why they are not going to be able to filter out anything except maybe microbes or bacteria, or microbes or parasites, and large particulate heavy metals or chemicals. But the smaller chemicals can still be there in our water, and this I have found to be a trouble in recent years in India, even with bottled water, because bottled water now has in India many bottled water brands, depending on what filtration system they are using, how much awareness they have about the filtration system's capacity to filter out whatever is contamination in their local environment, that contamination continues in these water supply. So like, let's say there is a bottle manufacturing unit, and in India we have all these industrial zones. So in industrial zones there could be a water manufacturing, bottled water manufacturing plant, there could be a soft drinks manufacturing plant, there could be also a drug manufacturing plant, there could be other chemical industries related manufacturing going on, all of them in the same area. So if there are 10 different industries now operating in the same small locality, and actually speaking there's more than 10 in India, but let's assume, I'm just giving a random example, but if there are 10 industries operating in a particular area and they have been operating actually for many years, enough contaminations is bound to be there in your local water supply of that area. And because enough chemical or microbial or heavy metal contaminations or any kind of toxin contaminations being prevalent in that area will exponentially increase with the exponential growth of the manufacturing abilities and manufacturing needs of that area. So area where the pollution was 10 years back maybe zero pollution level, that same area after 10 years of different kinds of manufacturing going on will have invariably contaminated water supply. But that contaminated water supply now, even if regulations are there, in India we are a corrupt country, so sometimes regulations are skirted, sometimes people just, I have literally seen some news articles and news information pieces on YouTube where the articles mention, like, let's say it's a clothes dyeing plant where clothes are dyed using chemicals, heavy chemical usages is going on in that area. So because of dyeing of the clothes, now that area has found issues related to environmental pollution, because of which some new environmental regulations came up in the area. So while some manufacturers are actually following the environmental regulations related now bans or regulatory changes that are to happen there, some small scale manufacturers or people who want to outskirt the law, what they have started doing is, if the dyeing plant was in Tamil Nadu, at the border of Tamil Nadu, which is away from the jurisdiction of where the ban is effective for the disposal of the chemical wastage of the dyes, they have just gone into a bordering state or a bordering city or a bordering district where now dumping of it is happening. So all that has happened is, instead of following the law to actually make sure that health harm doesn't continue in that area, they have now just shifted the problem from one location to the other. And this is also a problem that is prevalent globally. Actually, it's not just an India specific problem. Why do you think manufacturing has shifted from US and European countries to India, China, Africa and poor countries? This is a poor country, a developing country related problem. People think that just because manufacturing is providing people a lot of jobs, that means that you are bringing progress to your country, when in fact, along with progress, if the right steps towards progress are not made, you are also bringing a lot of disease and decay and problems. And if it is a highly populated, densely populated continent like Asia, Asia is actually the most densely populated continent of the world. So any country of Asia where these manufacturing things are being shifted, there as a result of the density of population also, the magnitude of the problems, which if in US, let's say US EPA found in a city of US after doing manufacturing activities, let's say it is a chemical dyeing factory there in US that used to be present in US 30 years back. They collected data about what is the harm of the manufacturing done in that area. And they have data also that if this level manufacturing is done and these kind of protocols were followed, this is the amount of pollution they found in that area. But in India, because now India has 10 times, 5 times, 4 times population more in different parts of India than in the same US city where that manufacturing plant was there in US, what is going to happen? Has that magnitude of the problem now escalated? Because population is more, demand for the products will be more. If demand for the products are more, then you have, and when manufacturing has shifted to a cheaper country, artificial demand for products also increases. That's why I have created those sustainability videos also, because this is also related to health and healthcare and long-term health of humanity. So these artificial demand is also created by because you're cheaply able to produce your clothes in a cheaper country or less cost, you are having some cost savings, so you end up buying more also sometimes from them, because you have more access, the money that you have in your company, you can buy more. So earlier, if in US with a particular kind of budget, you could your retail store could buy only 100 clothes from a manufacturer. Now with that same budget, because you are operating now in a poorer country, that same person might decide to, instead of buying 100 clothes from that same manufacturer's different facility, they might the manufacturer only might push for buy 1000 clothes from us or 500 clothes from us. So do you see the magnitude of problem has now escalated? And not only escalated, that magnitude gets escalated in two ways. If the demand for the products are causing 5 times increase, 10 times increase in the product just because they are cheap products, that is one problem. Second problem is, because the density of population in these areas is high, other factors, not simply the factories operational factors, but the local environmental factors, usages of the population's chemical and drug usages, all of it is also contaminating the water supply at a higher level. So in a country like in a isolated, and US, you will see like these places where manufacturing facilities are there in US, in the which is called the Bible Belt of US. In the Bible Belt, in the Midwestern regions of US, all these places are the places where many manufacturing activities used to go on in the past. And in those areas, they were all very isolated areas also, because not high density of population was there. So now there it was actually easier to now study the overall population's health impact at a small scale level. But that same small scale level where you in a less densely populated city of US or state of US, what has been happening to patients of those area, and people had the luxury and leisurely time and a long time to analyze the data of those areas. Indians can't afford to do that. And Indians have to rely, not just Indians, any country of the globe where density of population is 10 times more than a European or American countries' manufacturing ability related areas. You have to understand You have to rely some on information of past data, and you have to do a quick analysis of the data of your area to determine what is impacting your population's health, because population health is indeed getting impacted by the environmental conditions of the place you are living. So a person in Mumbai will have health issues related to not just simply the newest virus that is in the news that is causing some health issue in them, or the newest seasonal something that was detected in the water that is causing some health issues. It is also dependent on and actually it is more majorly dependent on in a densely populated country or city's population, on the chemical and drug usages of that area. Chemical usages which are related to cloth washing detergents, cloth dyes, hair dyes, cosmetics, home cleansing agents, foods and medications, related chemicals, whatever chemicals are there in our food processing, food industry related chemicals, chemicals in our shoes, chemicals in our anything that we do in our daily life. Hundreds of chemicals impact our health. And while in a normal healthy person, the chemicals will, if the chemicals are at a manageable level of the body to process those chemicals out from their body, a body does have capacity to eliminate many of the chemicals from our system when we are in good functional health. But when we are not in good functional health, or when as a result of living in a particular area for 10 years, the population density of that area has increased, hence the chemical contaminations of that area has also exponentially increased over the years, then both of them combined are now going to, the longer you stay in an area with a high chemical usage population, higher is your health impact that is going to continue on your health. And those are also the factors doctors and healthcare providers have to wake up to when treating a patient. And the other problem now in India, while initially in India also the manufacturing facilities that initially came up in India, they were all coming up in these isolated areas only where local population wasn't really high. So, and also in those areas where clean earth was existing at the time when the initial manufacturing facility was created. But if a manufacturing facility has been existing in India for 10 years, it could be a clothes dyeing factory, it could be a bottle manufacturing factory, it can be a medication manufacturing factory. Over the years of existence of that facility, that manufacturing facilities functions, as well as all its nearby neighbors, all of them combined are jointly going to contaminate and pollute the things that you are producing for the general population. This is something people have to wake up, must wake up. And the third thing people have to wake up is, if my main health issue is arising from already overloading of my system via different chemicals, sometimes some patients' health issues could be multiple chemicals overloading their system, leading to liver damage, kidney damage, skin damage, other organ system damage, cancer. All these things could happen when multiple chemicals have been wrecking your health for a while. But is just chemicals the only thing wrecking someone's health? No. Some people could have multiple chemicals wrecking their health. Another person could have chemicals plus heavy metals wrecking their health. Another person could have chemicals, heavy metals plus radioactive poisoning wrecking their health. Some people could have and if I lived in Mumbai for a while, all the chemicals and environmental conditions of Mumbai impacted my health overall status for the years I lived in Mumbai. Then I moved from Mumbai to another city, let's say Kolkata. Then the health issues and environmental conditions of Kolkata plus Mumbai are now impacting my health. If I used to live in US, Mumbai, Kolkata, all the environmental conditions of the water supply, food supply, medications, everything in US, of the clothing, everything that is generally impacting my health daily, all of them combined are now responsible for my overall health trajectory. From the exposures I have had while living in US, from the exposures I have had living in India, from the exposures I have had living in different cities of US and India, or if I'm a traveler, which I was in the past. I used to go on vacations once a year to certain cities, at least once a year or roughly around like that. So all those traveling that I have done to different cities of the world, that also the environmental conditions of those places also are slowly taking a toll on my health. Whether they will take a long-term toll or short-term toll is dependent on what? On the overall health status I had at that time. If I had good fitness level, I was detoxing myself, I was aware of what I was consuming was impacting my health, my overall health trajectory may not worsen. But if I was not aware what was impacting my health, or if some hidden parameters were there while I was traveling to some place that no one is aware about is impacting people's health, all of those also, that will not stop you from not getting impacted by it. The same way, and if you have antisocial personality related family, caretakers, or people, when you're traveling, you trust a fellow traveler and they ended up poisoning your food or giving you something, you don't know that you were poisoned by them, because all these day trip drugs or drugs that can cause you to lose your memory, people can put it in your drugs, you may have a memory lapse, but because you were traveling, too busy traveling, you may not remember that you had that short-term memory loss or few hours of gaps of memory loss as a result of being accidentally or deliberately poisoned by someone. And those things, but will they still impact your health? Eventually they will impact your health. They are responsible for impacting your overall health as well. And all these things are things people have to wake up on. Doctors, when treating a patient, has to wake up on. And if a doctor doesn't know only a patient's travel history, past patient history, and is it relevant information? Now if I go to a doctor, is it a relevant information for the doctor to know that I could have potentially antisocial personalities living with me in my home who could have accidentally or deliberately poisoned me with things, or I could have socially and mentally ill people. The mentally and socially ill people could have accidentally poisoned me, but the antisocial personalities could have deliberately poisoned me. The local environmental conditions are also poisoning me without anyone intending to poison, just because awareness is not there. Because if the lesser the use of drugs or chemicals in our lives, lesser is the pollution in that area, and then lesser will be your overall health impact. And another thing about how the chemical contaminations of an area can pollute your drugs, pollute your clothing, pollute your food supply, all these things are possible. The other place where people have to now have awareness is the fact that if chemical poisoning is part of my health trajectory, that is deteriorating my health, at that time when another chemical is now added to my medical regimen, because a drug is also a chemical, do you have to use the right drug as dependent on the patient's current health status. So that's why the overall patient status has to be understood by a doctor deeply, and an overall patient status that can't be understood simply sometimes by the subjective evidence that I was talking about in the previous video. Because, and as a PharmD person who has studied doctorate of pharmacy degree in the US, where I was involved in studying about the clinical parameters, diagnostic parameters that are necessary for determining the overall patient's health status, that is necessary for determine what level, what dosage of drug should be dispensed to a patient. I didn't finish that degree program, but I have at least partial knowledge of what is necessary to ensure that patient gets the risk versus benefit of a drug to a patient is understood by a pharmacist as well as by a doctor or a nurse who is administering things to a patient for treating them. This is a crucial element of drug therapy which is prevalent in US, where enough work related to all these subjects that I have addressed here, majority of my expertise comes from my student and work life experiences in the US, and some of it is coming from my personal life experiences in India and US. But I have both personal experiences and professional experiences understanding all these, that map that I'm talking about. I'm giving you a picture and map of what is actually going on, because many people who are not aware about all the pieces of this puzzle. Some people are only aware, like a doctor in India. This is a very bad habit of doctors in India. All they are responsible for, many doctors I know personally, are just doing this barest minimum healthcare delivery to a patient, which is that a patient comes to me, a diagnostic test tells me that they have thyroid problem, diagnostic test tells me they have cholesterol is high, and all they are doing is, I'll give them medication for cholesterol, I'll give them medication for their hyperthyroidism, and that's it. That is all they are doing. And if they don't do deeper scrutiny of the diagnostic test, that is problem of some doctors. Other doctors do not understand. You may have written a prescription to a patient. I know someone who is a very frail and smaller sized patient. Like, even though she's an adult my age, her body structure is actually body structure of a teen child, because she came from a village life and she might have had malnutrition in her childhood days. Whatever her reason for having a frailer build, this is also an aspect of drug dosage dispensation to a patient. You don't give simply a drug based on whatever you are normally used to giving a patient. But if there is a fat patient or a more robust sized patient, they need a different medication dosage than a frail patient needs. And that patient's literal narration of their health history told me one time that they had chronic acid reflux related problems with their health. As a result, they used to earlier take, they were given proton pump inhibitors earlier. But despite their original proton pump inhibitor prescription of omeprazole that they were taking regularly, one time, because they had eaten too much acidic food, their health incidence escalated. And as a result, when their health incidence escalated, they again went to a doctor. They were vomiting up possibly more acid. Higher acid reflux happened to them. At the time, the doctor gave them a higher dose, like while they were on 20 milligram omeprazole. What the doctor did was, they gave them another PPI plus a combination. And in India, PPIs are not prescribed separately also. Some PPIs are given along with domperidone. I don't know all the combination medication names. I don't know the brand names. But I had looked into her prescriptions because I was a former pharmacist. So when I looked into her prescriptions, I saw that she was given a combination medication of PPI plus domperidone. Domperidone to reduce the secretory elements, and then and to reduce her vomiting, and then the PPI to reduce the acidity. But now the problem is, they have not asked any due diligent questions related to what medications does the patient take. This is a basic thing doctors should be asking their patients, but many doctors do not ask this question of the patient. Because if they had asked this of the patient, what medication you have used, what had this happened to this patient was something called duplicate therapy, which is something, again, pharmacists are involved in understanding about a patient in US, because pharmacists keep record of patients, and now if the patient comes again and again to the same pharmacy, you have the entire record of whatever the patient has been using for a while. So for that pharmacy where the patient goes regularly, it is very easy for that pharmacist, if they are mindful pharmacists, attentive pharmacists, to understand that a duplicate therapy is happening. Same way, US also has patient records in the hospitals as well, where the recording of whatever medications they have used in the past is being kept in the patient's file, medical files, in the IT files of the patient. So you revisiting whatever medications the patient has used in the past is also an important criteria for a doctor also to understand whether they are doing duplicate therapy. So what happened to the patient, the reason why I got introduced into this therapy element of this patient was because she had extreme dizziness as a result of, first of all, earlier she was on omeprazole. This was another drug, I don't remember, I think it was rebeprazole, I'm not 100% sure, but it was a 40 milligram dosage of something which was not omeprazole. And she has, first of all, she is a frail patient. Now she has duplicate therapy going on. And she has, while she normally takes 20 milligrams, she was now not only taking her old medication of 20 milligram omeprazole, she was also taking 40 milligram rabeprazole, she was also taking domperidone. All of them together now had some drug interactions in her frail body structure, leading to extreme dizziness for her. And because she felt it was possibly her new medication that was causing her extreme dizziness, eventually she stopped taking it just because she was a little wiser patient. But if some patient is not wise and mindful about their health status, what will a unknowledgeable, unaware, unconscious patient do? They will continue taking this duplicate therapy. And when she talked to me about her medications, I said, yeah, you did the right thing, because you don't need to take both these medications. Either take the omeprazole or take the rabeprazole with the domperidone. Then slowly, and she doesn't, when she had that extreme acid reflux incident where a lot of vomiting was involved, at that time if she takes domperidone for short term, that is a good therapy. But if she continues, this is the problem in India, which is another problem zone, because another time another health incidents happened, and I told her that and she was possibly going to check up with the doctor for some other health issues, but her past medication usages was also going to be addressed by them. At that time, she has I told her that you are using these two, the medication that now she is a less educated and less health aware person, less aware about medication contents related person, which is mostly a pharma person, chemistry person, biology person, or biochemistry person, or a pharmaceutical industry working person understands this more deeply. Even general doctors in India don't understand this more deeply, I feel, because they should realize that if you are giving a patient domperidone plus rabeprazole, you don't need to continuously give them domperidone plus rabeprazole. That will cause a long-term health harm, that the body's secretory capacity, normal secretory capacity, might get ruined in that patient. That could be one problem. Another problem is they had a immediate urgent health incident. At that time, maybe this combination medication was needed for a week or 2 weeks or a short term duration of the therapy. But after that, when she is now mindful, she knows that she ate certain very acidic fruits that had escalated her health incident. Again, she had that much mindfulness to understand, because this is a chronic health problem she has been facing for 20 years of her life. So she has slowly developed some mindfulness related to what foods impact her acidity, escalate her acidity related incidences. So the mindfulness that she has developed about what foods are escalating her acidity incidences, at that time she is mindfully aware now, because eating this fruit caused her the acidity. She stopped consuming that fruit from that day onwards. But the problem is now, if she has stopped consuming that fruit that had escalated her incident, does she need to take the medication then long term? Once the impact of that chemicals that might have been there in the fruits that was adding to her acidity problems has now got eliminated from her body, which will usually take maximum 1 week for a person. That's all that she needed to take this medication. At that time also, if the doctor is doing right due diligence of prescribing, he has to tell her to stop taking the omeprazole. Or if she is taking already omeprazole, if she had asked the right question, all he might have had to tell her to do was double the dosage of omeprazole for a while, and then when she has stabilized, go back to her normal dosing. This is kind of like the prescription patterns that would emerge in a patient's therapy in US. Or if a pharmacist gets involved in understanding duplicate therapy in a patient, a pharmacist will intervene and inform the doctor that, hey, duplicate therapy is happening, tell us which drug should the patient continue for a while. Because the same incident that happened to this patient related to her acid reflux chronic health problem is also the same kind of incidents that happened to another patient who got hospitalized in a hospital. And in US healthcare, what happens when you get hospitalized, sometimes hospitals have a different drug formulary. So the patient had some cardiac problems, some blood pressure related problems, so because of which they had some cardiovascular blood pressure monitoring related drugs in their prescriptions, and they had duplicate therapy related to those drugs. Because what happened was, if they had I don't remember all her drugs, but it was like calcium channel blocker, beta blocker, or hydrochlorothiazide, something like that was all there in her prescriptions. And out of that, if a drug A and drug B was being used by the patient regularly as a part of their normal therapy with a particular dose. When now the patient is there in the hospital, what hospitals do is they have a hospital formulary. So because of which some other drug, which is if drug A was a calcium channel blocker, but instead of drug A, their formulary has drug C, which is a calcium channel blocker as well. They will give them the drug C that is in stock in their formulary than give them drug A, and an appropriate therapy dosage adjustment would be done according to the medication change that was done in the hospital, right? Similarly, the drug B, if it is a drug like a beta blocker, again, if drug B was a beta blocker that was generally given to the patient, but there is a formulary change in the hospital's pharmacy, instead of drug B they are getting drug D now, which is a different beta blocker, and again a different dosage of that beta blocker is given. And while, like, let's say for drug A and B, 10 milligrams of drug A, 20 milligrams of drug B was given to the patient once a day, for the formulary changes it's 20 milligrams of drug C and 20 milligrams of drug D that has to be given to the patient. But the duplicate therapy now arose. Why? After the patient left the hospital, they were given now the prescription related to what they took in the hospital, and that prescription then got approved by her general MD, but the general MD didn't double check that duplicate therapy is going on. So the patient landed up in my pharmacy with now I already know, because I was familiar with the patient, that was a regular patient in my pharmacy. So I already knew regularly what are there were A, B, F, G, other like 4-5 medications that the patient who used to regularly take for their different health conditions. Some related to blood pressure, some related to cardiac health, some related to possibly sleep or pain related problems. So like that, they had general 4-5 prescriptions that they would monthly pick up from the pharmacy. And I do have some good memory. I didn't have a large patient load, both of which meant that I remembered that the patient used to take drug A and drug B, and now she has come into the pharmacy with drug C and drug D. And then when I was typing up the drug C and drug D information, now because I am a mindful pharmacist, because I remembered her past history, I also have a chance now to look up her past history in our software system as well. So when I looked up in the software system also, I saw that she had recently picked up few weeks back the drug A and drug B, and now she is wanting to fill drug C and drug D. So there would be duplicate therapy of both beta blockers for her, duplicate therapy of the calcium channel blocker as well for her. So that's when now I told her that this duplicate therapy is happening. I explained to her. She had a language barrier because she was not originally she might not be an American citizen. So she was from a European country. So she didn't understand English that well. So I told her, can you bring someone who understands English? So, and in the meantime, I told her that I need to check something with the doctor. So I tried when her son came, I tried to explain the situation to the son. When the doctor's office, I called them back to ask them about the duplicate therapy, so that in the future she doesn't continue with this duplicate therapy. But which pharmacist is going to be able to do all these? One who is mindful, one who knows her patients regularly. A doctor also can have the same capacity to do this mindfully for their patient when they are also mindfully looking into patient old data as well as new data, right? And because she had a hospitalization incident, obviously other than drug C and D that were changes in formulation from her past medication, there were other medications also that were prescribed to her. I'm not going to change or challenge any new medications that the doctor has given according to her current health status. But if some duplicate therapy has happened, that duplicate therapy needs to be addressed. Otherwise, the patient essentially is taking two of similar drugs two similar drugs, and double dosage, double impact of the drug will happen in their body, which can lead to cardiac arrest, which can lead to respiratory problems, which can lead to, if some other problems were also going on in their body, it can lead to kidney failure, liver failure. It can lead to whatever the individual impact of that drug's overusage might be in their body, right? So this thing related to duplicate therapy is also applicable in a very odd way with earth pollution parameters as well, because earth pollution can also lead to duplicate therapy. And about this related to earth pollution and duplicate therapy related to earth pollution, I will it's a new concept that people have to understand, so I will make a new video later on. But how duplicate drugs, one prescribed by hospital A and one prescribed by her original medical prescriber B, can result in duplicate therapy for a patient. If you are mindful, you will give the right information to the patient. If the patient is mindful, like let's say she had continued to take this medication for 2 weeks and had actually duplicate therapy going on even before she came to fill a new prescription at the pharmacy, at a time what is going to happen? She'll feel continuously dizzy, because she will think, I have to take this old medication, I have to take this new medication. She will consider that all the medications given to her by the hospital is new medications. She doesn't know, yes, they were new medications, but some were the same class. If she's not educated enough about her medications, she doesn't know it is the same class of drugs if no one educated her about her medications. And plus this patient also had language barrier. So even if the hospital tried explaining to that patient that, you know, this C and D drug is actually same as or similar to A and B that you used to take. That's why take only C and D, do not take A and B. So if language barrier is there, patient may not understand this. Even if language barrier is not there, if the patients did hear what you are saying, but because they had recent health incidences or they could forget what was happening, if you had caretakers with them who were stressed out financially or due to the fact that they emotionally distressed because the patient had a health incident, severe health incident, at that time also family members do not listen to what the instruction was given. And these are all happening globally, everywhere, to any patient. This is not common only to US. This can happen anywhere in the world. Only difference is in US, at least patient information is given, enough patient records are tracked, as a result of which the minimization of these duplications of therapy, health harm associated with wrong therapy, if some drug interaction, now if a new drug was given to her and that interacts with some past drug that she was not possibly given in the hospital, but is a drug that she occasionally takes for pain or other purposes, at that time if drug interaction shows up, all of these are also places where a pharmacist will call a doctor, talk to the doctor about changing the therapy, changing the medication. If there's insurance issues, we talk about the insurance related aspects. So these are the functions that a pharmacist is doing continuously in a pharmacy in US. But this level of pharmaceutical care doesn't happen in many countries of the world, because they don't store only patient information, or even if they do store patient information at a superficial level, the right usage of the information that is stored about the patient is not happening. So people in India, which I have understood, in pharmacies in India now, they have started storing patient information, patient records of the medication they are using. Now that could be beneficial if you want to use someone, if you want to track someone for illegal drug activities possibly. But even there also in India, there is no identification seen of a patient. There's a lot of gaps in India where in my name, anyone can fill up a prescription in my name when it is not really my prescription. So someone can do fraud against me, make a prescription in my name that they are filling in my name that I have never used, but someone else is using. And because in India drugs are so easily available, anyone who knows you and has a fraudulent mindset could be doing things related to you behind your back. You will not even know that something like this is happening, especially because the systems are lax, the understanding of a criminal mindset is lax. People who are antisocial personality or criminal personalities know how to use the loopholes of the system, and it takes someone who has worked with those people or who was abused by those people only to understand how these criminal minds work. Otherwise, why am I making these videos? I talked about my dad, and I also talked about this random thing about my prescription related. I know someone has done this. This is again a universe guided thing. People don't believe this. I have no record of what is, and there is a reason why the many people wonder, like, despite having all this education, why is this woman not working currently in healthcare? There's a very strong reason related to both people outside my home who have used my name for doing fraud activities against me, and people in my home who are drugging me deliberately. Both of these factors have now led to a certain point of crisis in my life, where that is the reason why. It's not that God, people don't believe in God, but God does exist in the world. God did know that something related to possibly medication related problems might arise in my future. As a result, every time I have been rejected into going and joining a pharmaceutical industry, because these are all my education expertise. I could have joined a pharmaceutical industry, whether I may not have joined at a top level because I don't have many years of experience, but I could have joined a pharmaceutical industry, I could have joined a hospital, I could have simply joined a pharmacy as a chemist, all of the places where I could have access to drugs. But I was also at that time doing some spiritual practices, also going through some major psychological abuse related challenges. At that time I needed to heal myself desperately from all the emotional health issues, and I wanted to stay clear of drugs. So because I was just guided to do it, to stay clear of all kinds of drugs, all kinds of, and then slowly I had some skin allergy related issues crop up. So I started not only staying clear of prescription drugs, I also started staying clear of taking chemical usage of different kinds from different sources. But that is how only I discovered that when I'm not using, like, for a while my skin looks pretty clear here in this video, because for a while I have not been using harsh chemicals that we usually use. Even in face washes we have harsher chemicals nowadays. So I used to use face wash for many years of my life. Home remedies related to face related things also have done occasionally in my life. Despite that, I got heavy allergies to materials that are available for women in India, and as a result I stopped using those chemicals, or very bare minimum usage was happening. And that is how I discovered the problem related to water pollution in our taps and water pollution in our general water supply in different parts of India. Something that I didn't realize about US, but now if I correlate some of my health symptoms from US days, I do know that some of my health symptoms were stemming from water pollution or other environmental pollution related factors of the places I was living in, which is an important factor also for treating a patient now, because of their environmental factors, home factors, personality of the people who pretend to be their caretakers but aren't caretakers, are all the things doctors have to responsibly understand about a patient. If a personality type is an antisocial personality, very careful medication should be given to them. They should not be given heavy medication access as well, because the antisocial personality of my family has drugged many people inadvertently without people knowing they were being drugged by them, because he's a very sharp individual. He just knows much more sharper than me. I know that this person has much more higher IQ about knowledge related to medication. I forget sometimes, like, God literally made me not practice anything related to healthcare for 7-8 years of my life. Anything where I would have medication or chemical usage access, or the need only, I got this sickness also so that I don't have the need only to want to use any drugs anymore or chemicals anymore, because drugs and chemicals were causing a lot of health issues. Like, I have very minimally used drugs and chemicals in the last few years of my life, and much more sparingly than I used to use when I used to live in US. And work access related things were completely stopped because of this reason, that this problem related to antisocial personalities or people misusing my name to commit fraud behind my back, this is a thing governments and regulatory practices have to understand. Like, and I'm not the only one who's been defrauded this way. There are multiple people who have been abused covertly like this is a covert abuse, right? Like if someone is using my name to build a data set where apparently I'm using some drugs that I have never consumed in my life, or only one time I have consumed and after that I have never used that drug. According to the records, it is my record showing that I am using that drug, when the reality is I am not using that drug. I have not been using that drug ever in my life, and someone else is gaining access to that drug to now do some things related to drugging of other people, doing their antisocial personality or criminal motivations related activities using someone else's name. And people in India, this is another thing, the drug authorities in India need to work on this. When I was a pharmacy student in India, after graduating from pharmacy, I had got the prescription pharmacy license, because at that time for a few weeks I had worked in a local chemist shop in Mumbai. And to work in that chemist shop, I needed my pharmacist license. So I got, not many pharmacy students who graduate out of pharmacy school actually go and get their pharmacist license. Now, out of all those students who don't even go and get their pharmacist license, even their pharmacist, just because they graduated out of pharmacy school, they are eligible to get license. So now if someone wants to do a fraud, if 30 students from my college graduated with pharmacy degree, out of those 30 students, 10 students maybe got a license for pharmacist. The other 20 students didn't get a license. Why? Maybe because 20 out of those 20 students, 5 students got married. They never practiced pharmacy at all. Another 5 students went into business or some other school, so they never worked in the pharmaceutical industry, or very briefly worked in it where licensing was not required. Another 10 students went internationally, and in international coursework that they were doing, again they didn't require the pharmacist license. So as a result, now what happens? There is a whole batch of students who are eligible to get a license who never applied for license. But because it's a criminally inclined country, is there a potential now of people gaining licenses in their name who know that there are these 20 students, and if they have, high level criminals, they have tracked also, like maybe they have contacts in visa institutes, then from visa institutes they can get the data of which of these students left the country. So at least those students who have left the country, their profile can be used to create now false licenses for illegal activities. That could be done by someone. There could be some people who could be tracked simply via LinkedIn as well. Like high level criminals can do all these things. You can look into the LinkedIn, into someone's education profile to see, oh, this person also could be eligible for a pharmacy license because they did bachelor's from such and such a university. Let's use it. Because all you need is a criminal set of contacts to work jointly and collaboratively together to gather enough information of someone to use their information for doing illegal activities, which the person has no clue that the illegal activity is going on behind their back. And this I understood about myself many years later. And for me, for a person like me, I did create a license. I did practice in India for like a few weeks with a pharmacy. Then I moved to US. For 2-3 years I was not doing any pharmacy related, pharmacist licensing related work, because for 2-3 years I was a graduate student in a university doing research work. But after my research work ended, and at that time I relinquished my license in India and created a new license. And after relinquishing that license, I got a new license. I did the licensing exam steps in US to get a active pharmacist license in US to practice as a pharmacist in US. So at that time point, I don't know if anyone used my data, but after I worked as a pharmacist for a while, there has also been a time when I have come back to India where I have not been working as a pharmacist in US. Now again, is there a potential of someone now again using my data to create some things if they had, and are there many people who had access to all my personal information? Yes. I have interacted with people who have come to my home, stayed in my home as a friend, invited me to go to their home as a friend. Later on, I realized those people were also antisocial personalities. Not at the time when I trusted them. At that time, I implicitly trusted them. But later on, I realized that it was very suspicious that out of 4-5 times that I have eaten meals, shared meals with them, at least 3 times I have fallen asleep after sharing meal with them. And one time I also believe they have done some other excess activity simply than just drugging me with a drug. And that thing has happened with me. Then their behavioral patterns have shown that something suspicious is going on with their behavior. Then finally, the thing is, these people who have these antisocial personality traits, they do not have any conscience about how their choices, they are so hell-bent in making money or profit or gain out of something. They do not care how it will impact someone else's life, how it can ruin someone else's life as a consequence of the choices they are making. Some people do not care. They are that level manipulative or criminally oriented. And some people care what? They are antisocial personalities, so they care to have fun at the expense of another, fun at the expense of creating misery in a life of another human being. Because for them, they have that sadistic nature that for them it is extreme fun to see someone else suffer, even, and the more innocent the person, the more they are having fun in causing suffering to that person. So these are things necessary for government systems, regulatory system, financial system, legal system, medical systems, people who work in medical industry, pharmaceutical industry to understand, because not every employee you are employing there, everyone you are collaborating with for work purposes, doing business ventures with, are going to have the same level of ethics as you, may not only have the same level of ethics as you, their morals could be so corrupt that they will do anything to implicate you in fraud activities where you had nothing to do with that fraud. So these things, and those people are innocent people, so they need to be, first of all, there are innocents who are trapped in whose names have been used for fraud when they had nothing to do with fraud. Those people are the innocents. The second innocents are those people who were supposed to get legally some access to some medications for their treatment, but the legal access to the medications they were supposed to get never reached that patient, and instead the drug was diverted for illegal purposes and resale purposes for the medical black market. That could be happening. Those are also innocent patients that while you were supposed to get a particular treatment, you never got that treatment. Then there are those people who are the antisocial people, who are the criminally inclined people, who will also use all these gaps in medical wastage. There could be, someone who's antisocial personality, and I have worked with antisocial personality, live with an antisocial personality person, so I understand their patterns of how they abuse someone, how they pretend that, oh, this could be an error. Like, the person who I am alleging is a antisocial personality person. That person has repeatedly done these activities where they use partial truths, they fudge the truth, or they pretend they have made an accidental error. So for example, if this is an allegation only, this is not a provable thing, but something similar like this with normal daily practices at home that person has done, where let's say that 3 times a day dosing that I was just narrating as a random possible incident that could have happened, and that even if it didn't happen in this home, doesn't mean that an antisocial personality with that behavioral pattern doesn't exist in someone else's home or someone else's hospital, working as a nurse, working as a pharmacist, working as a doctor, working as an intern, who could have the same access to those drugs, who could be doing this small sneaky things, where if like how with my grandmother, I'm alleging that her medications were now used to poison my mother or drug my mother. Those same medications, which could have been either a dosage change related thing where the person could say, oh, it was not a 3 times a day dose, I thought it was only 1 time a day, or it says up to 1 time a day, so I only got 30 tablets right now. They could pretend like that with their family. Like, let's say 2 people know that the therapy is up to 3 times a day dose for a patient. not specific to my grandmother's case, but let's say it's another patient, and where two people know, like the son also knows that up to 3 times a day is the dose. The daughter-in-law also knows it's up to 3 times a day dose. Now, because the son knows it's up to 3 times a day, and the daughter-in-law told the husband, like, your mother needs this prescription and we need to fill 90 pills, go and get it from the pharmacy. And whoever is a caretaker of an elderly person or a spouse or some family, they do generally tend to have the access to patients' medication sometimes. So because in our pharmacy I had parents picking up medication for children, sometimes those parents would also send their children to pick up medication for them, and I would allow it, even though it was slightly gray zone, but sometimes I would allow it, we would allow it, because we knew that family for many years. So many people can build this trust also, ki I am normally coming, and there was another family like that where the husband was repeatedly picking up prescriptions for the wife. When one time later on I found out that they went through a divorce, and after that also, because of HIPAA laws and everything, some other HIPAA related things we had to do, where the the husband can't have access to the wife's drugs after they went through divorce. But until they had gone through divorce, the husband had access to the wife's drugs many times. He would come and pick up the drugs for the wife many times from the pharmacy, and he seemed like a normal husband. People are not, at that time I didn't analyze his personality type, but only after seeing what happened with that couple, I understood that the husband was likely misusing her drugs or giving her wrong prescriptions deliberately to make her fall sick, because there was a medication error that had happened that they blamed on our pharmacy. And on the day that medication error happened, the other pharmacist who was working was a floater pharmacist, and that floater pharmacist did have a general tendency to be a little unmindful about drug dispensation related stuff. So I at that time didn't suspect that the husband could have also replaced the drug, right? Because when let's say husband comes to pick up 10 milligrams of drug A from the pharmacy regularly for the patient, that is the prescription, 10 milligrams of a drug A. And the day the floater pharmacist was working, that day accidentally, instead of 10 milligrams, 15 milligrams of drug A was given. Now, a week later, the patient comes and says, you have given us this wrong drug. And I'm like, how can it be the wrong drug? So I went and checked the profile and everything. And then I realized some dispensing error had indeed happened by us. So I apologized, and all the steps related to that. I think some steps related to that I did. Some steps I wasn't wise about reporting some of these things. So some steps I didn't do at that time. Though I had been working in the pharmacy for a while. Now this is another problem. Even if you are been working in a pharmacy for a long time, if certain challenges you have not faced in that facility for a while, or you didn't get appropriate training, you may have had some training modules that you went through, but how to actually execute those training steps have not been right. Education is not present, right? Information of how to do those steps are not present to you. Then at that time, even if you have been working for a few years, you may not know all the protocols. So I didn't end up reporting, I think, the thing completely. But I think she again came another day to complain. And at that time, I was also a little bit defensive about it, thinking like the pharmacist couldn't have made a mistake or something like that, I randomly thought. But then later on, I realized, yeah, pharmacists can very well make this mistake. But as a result of someone else's mistake, every time I was filling prescriptions from that day onwards, from that mistake, I learned to double check. Earlier, I was only double checking the medications. I started triple checking certain parameters of what was getting dispensed to ensure that this error of 10 milligram to 15 milligrams doesn't occur. But while the wife thought, and this thing maybe while talking with the wife, we can find more information about it. While the wife thought that the pharmacy had done a dispensing error, and maybe one time the pharmacy did indeed do this dispensing error, what if that now inspired the husband to now start doing dispensing error and medication pilfering related things? So what he could do now, like let's say the patient now takes another drug, which is a pain drug, 500 milligrams of that drug, and instead of the 500 milligrams, the doctor has changed the dosage to 750 milligrams, but and they had been working in another pharmacy too. So what can the patient be doing, or the patient's husband be doing? The old prescription that she's not using anymore, that could be there in a different pharmacy, and a new prescription could be there in my pharmacy. So while he's picking up the prescription that is her new dosage from my pharmacy and giving her that drug, the old prescription also he's keeping on renewing until doctor says they need to see a patient or something. But until then he has a few months of opportunity, or sometimes a year of opportunity, to pick up a medication on the name of a patient that he can use now to either drug her or do other illegal activities, which I believe is the reason why they eventually got divorced. But that is something I'm speculating. This is not something I 100% know that definitely happened with them, because I never discussed this with the patient. But there was definitely a suspicion surrounding the medications he was picking up for her, because she was very careful despite HIPAA laws. Sometimes if you trust someone, some HIPAA violations inadvertently can happen by people who are working in these fields. So if you aren't aware that divorce was going on, if you aren't aware that this person who was normally picking up her prescriptions now shouldn't legally be picking up her prescriptions, all these things, if we aren't aware about it, so she made us aware about it. So after that we stopped giving her information to that husband. But before the time when we weren't aware, and if she hadn't intimidated us, he could have again manipulated the system to take medications on her name, do illegal activities on her behalf. Like he could, if he has picked up a narcotic drug, in that narcotic drug he could either use to poison her, like, because it will be again duplicate therapy, extra therapy, that if she was only supposed to take 750 milligrams of drug once a day, and he is giving her 500 milligrams in her water plus 750 milligrams, that is a duplicate therapy or extra therapy, and it will make her feel more drowsy, which then he can use for doing different things. If you have looked at Giselle Pellicot's case from France, there the husband was drugging his wife using these kind of medications only, and from where he was getting the access? He was either getting prescription for it for pretend health issues, that he could go to a doctor and talk about some pretend health issues, or like he may genuinely have had that health issue, but let's say he had a like how I mentioned that I had only sleeping issue one time, and after that one time I never took those sleeping medications. But a person like that who may have had one health incident where they needed sleeping medications for a brief 1 week, but after that they never had the need for those medications, or they decided that I don't need to take any medications, that patient will not take it. But because a prescription now has been written in the name of the patient, this Giselle Pellicot's husband could have he had 3 families, he had grandchildren also, he has possibly other relatives also. And if you trust your family, you can have access to the medications that they have used in the past as well. Or even if you discuss with your friends, sometimes though these are all confidential information, people sometimes discuss with their family also about their drug usage patterns. So if he knows now someone in his family who is not using a drug anymore at all, or he himself got a prescription for a drug that he didn't use that he very rarely uses, but he goes regularly whenever you see a doctor. Now this is where the doctor's offices need to become aware about these manipulations of the system that criminally minded or toxic people can do for to use a legal system and a legal way to illegally use the drug against someone. So he could have gone, and if he's getting a sedative hypnotic, he uses it probably only once a month, whereas the rest of the 29 tablets, what he's doing, he's crushing it, mixing it in his wife's drinks and giving it to her on the days when the rape was happening to her. That is how he was likely doing it, right? How else could he have done it? Either he was doing it, he was getting access to those drugs via his grandkids from illegal street sales. So there are all these potential places where he could have had access to drugs. Or if he goes and knows that his friend has sleeping problems, he goes to his friend's house, and most people keep their drugs in their, very normal, either in the kitchen it will be there, or in their bedroom, or in their bathrooms, right? These are the places drugs drugs can easily be accessible to a criminally minded person, it's very easy to, pilfer 1 or 2 tablets from, if they know that this person is not that mindful, they can very easily pilfer a few tablets from a person's repertoire without the person knowing that tablets were pilfered from them. Right? And like that, if he collects from 10 different friends 3 tablets, does he have 30 tablets already, access to 30 tablets that he can do something with? And all of these tablets, when given only once normal dose, for depending on your body's metabolism capacity also, some person could metabolize a drug very easily, or might take long time to metabolize a drug. At that time, a drug with a normal person, it might last in their body for 6 hours or 8 hours, but because they are slow metabolizers, they could also have the drug potentially in their body for 10 hours or 12 hours. That can happen to someone. Or someone who is a fast metabolizer, he has understood what is the metabolism capacity of this person, so instead of giving one drug, he's giving 2-3 crushed drugs or 10 crushed drugs, which all of which puts her at a great health risk. And this is also something where, with Giselle Pellicot's case, this aspect of criminal abuse related thing also should be charged against her husband and other people who were involved in the illegal drug procuring related stuff, or drug related illegal gray zone related things people have done. And justice system needs to change the law if there's no law that exists to address these kind of criminal activities as well. And like with Giselle, how her husband is now slowly pilfering from one tablet from here, from there, from different friends possibly. He could have started with doing that, and then he could have found criminals like this. One who has been doing criminal activities for 10 years would have had a whole set of different ways in which he was likely procuring these drugs. And initially it was possibly small scale things he did, but the more he got away with the crimes, he likely went bolder and bolder. Same way with the antisocial personality I mentioned in my stories. And also and there are few, it's not just the one person who I mainly mentioned, but I do have believe that I have had contact with such kind of personality types from various other sources than just simply family. And then with similarly, like how a person can procure small amounts of drugs like this at hospitals. In hospitals, when critically ill patients are there, at that time also some emergency medications are usually dispensed to those patients. And in those emergency medications also dispensed to the patients, the protocol in a hospital is that if a bottle of some medication has been opened for the patient, and that bottle has now 30 tablets. And now the patient, while in the hospital, based on the dosage they are getting, they're actually not supposed to get 30 tablets. So technically, if the pharmacist is more mindful, they shouldn't be dispensing only 30 tablets. The 30 tablets is dispensed when, if they were outside the hospital in a regular setting, and like let's say the patient takes 1 pill a day of a sleeping medication and their normal prescription says 30 tablets. But ideally speaking, most sleeping pill patients, if they are not addicted to their drugs, or if they have not been using their drugs for a long time, if you're the new users of those drugs, they might not even, like me, if they're people like me, they might use that 30 pills I can potentially use for 1 whole year, using it on and off 2 or 3 days in a month. That is what I could technically be doing. I didn't even do that. In my case, I only, the majority of my pills just went to waste and had to throw it away in the garbage. But in the case of a patient who is minimally using the drug, not using the drug daily, because they don't daily have a sleeping problem, but because that prescription was now picked up from my pharmacy and the hospital doctor is now prescribing it to the patient, they could have dispensed 30 tablets now. The pharmacy just gave them the same pills. But the patient only stayed in the hospital for how many days? The patient only stayed for 1 week or 2 weeks. Now, technically, when they are being released from the hospital, all the medications that were picked up that were lying around in the patient's room should be given to the patient possibly. But sometimes certain hospitals are careful about anything that was lying in the patient's room should be now discarded instead of giving to the patient, because anyone could have come to tamper with that medication. So it depends now what law is being followed in that facility. But whatever the law is being followed now, or people do usually give, like if you have had a cream that you have to apply for a wound, and that cream is now 45-gram cream that can actually last you almost 2 months if you use that tube. People who don't want to create wastage, medical wastage, will give that cream away to the patient, even though technically maybe they are supposed to throw it away. Same way with the tablets, they will give it away to the patient, which is a more less medical wastage will happen if something like this was followed. But if it wasn't followed, or if someone has a criminal mindset where they deliberately do not want to, like even though 30 pills were taken out by the nurse to dispense to the patient once a day, and the patient only stayed there for 2 weeks, so they had 16 pills now that was not given to the patient, but which is still in the patient's name, which should now go to the medical waste of that hospital. But if that nurse is now, or technician's assistant or someone is aware that where the medications are being thrown away, at that time, if right record keeping doesn't happen in that hospital, right mindful people are not doing these work in the hospital, sometimes people can occasionally, again, like out of those 16 pills, they'll pilfer one, possibly no one will notice if 15 or if someone was doing some data recording also, and tracking of these medications were being done in some way. I don't know these steps, I don't know what was going on with the medical wastage angle, but I did see that a lot of medical wastage was indeed happening in the hospital. A potential for medical wastage that could be stemmed with a little bit more mindful dispensing of right quantities of medication. That was the angle at that time, because I was operationally inclined. I was looking at that angle when I was doing this project. But the rest of it, how the medical wastage is actually tracked, or what are the steps for all the nitty-gritty details of what happens with that medical wastage, I don't know. All I know is if extra drug is there, it has gone, and the patient has already left the hospital, it needs to be thrown. This is the part I know about. But while it is thrown, I know in pharmacies how we throw away those medications. There's a whole set of record keeping done for expired products. So similar, some steps would likely be present in a hospital also. But while recording now, if 16 tablets were remaining, but one tablet was pilfered, 15 and 16 is a number that can easily look very similar to each other, right? So people might think, oh, maybe it was actually 15 tablets which were remaining. So once or twice, if someone is a very sneaky and highly sharp criminal, they can once in a while pilfer one pill here, one pill there, one pill from this patient's profile, one pill from somewhere else. Like that, they can continuously do it, and eventually have accumulated enough drugs that they are selling on the streets, or abusing themselves, or using, if they are antisocial personality, using to poison someone in their family or friends group, right? But when will it get detected? It can only get detected if the systems are proficient, if everyone is mindfully doing their work, everyone is aware and understanding the personality type of the people they are working with. So all these things only can cause a doctor or a nurse, like a doctor could be suspecting that someone is stealing drugs, because he's repeatedly maybe seeing that one number off is happening and he doesn't understand why it is happening. Or a nurse could be seeing it, or someone else, a pharmacist could have observed it, someone in the hospital could have observed it, many people also potentially could have observed it. But the person who's pilfering maybe is a custodian who goes from one sector of the hospital to the other, or an assistant who runs around in different parts of the hospital. They could be doing it. So these things, people need to become mindfully aware about it. Or a doctor who is in the habit of checking up with a patient might be doing it surreptitiously, taking one tablet here, one tablet there, in those dosages. And these dosages also, right, related to up to these many tablets a day kind of dosing, also needs to now go away from prescribing patterns of patients, because these are the greater the vagueness of the steps used, or vagueness of the dosage used, overburdening of a system of healthcare delivery going on, lack of mindfulness about the places where some poor operational strategies are going on. These are all the places where these kind of things are more likely to happen. Why do you think I am more hyper aware, hyper vigilant about these topics that I'm discussing here? Partly because of my personal health issues. Secondly, because of the patient population type that I have worked with and observed who are these criminally inclined people. Also partly because I have a very analytical mindset, so for me to map out where the problem is occurring is very easy. And if there are 5 areas problem is occurring, I can easily map out that 5 areas where the problem is occurring. If there's only one area where the problem is occurring, I can map out that. If multiple people are involved, some of it is a intuitive guidance or just simply a personality analysis of the people, where even though I may not have concrete proof that this is the person who has done it, intuitively I can understand this is the place where the problem zone is. Now some investigation needs to happen to actually now figure out who is the actual person who is doing it. I hope this made sense. This is very necessary, very important, not simply for right patient delivery, right healthcare delivery, right healthcare treatment protocols for patient safety purposes, for understanding the risk and benefit of giving certain things to a patient or someone pretending to be a caretaker of a patient. I had mentioned, I think in my previous video also, the fact that not only was my mother like this sleeping a lot, which my dad gave a narrative that my mother is depressed, so he forced her to now go to a therapist, where he pretended again to be a very caretaking husband, sweet husband, that my wife is whatever he did, because I was not present in that interaction with the doctor. But knowing my dad, I know he can very well fudge being a concerned father or a concerned husband or a concerned whatever he is pretending to be. And while pretending to be a concerned person, he convinced the doctor that she might have mental health problems. And again, at that point of time when my mother was diagnosed with these mental health issues, at that time I was a little older. So I was like in 11th or 12th standard. And at that time, Prozac Nation related newspaper article had also come up in our newspaper. So both of this, or not at that time, but maybe in pharmacy school, Prozac Nation related things had come up. So between the time he was projecting my mother to be mentally ill to the time I was in pharmacy school, in those 5-6 years, somewhere during those years, I had checked some of my medications of my mother. I know that she was given SSRI and some other medications. And now SSRIs also have the capacity to cause you drowsiness. But sometimes SSRIs may not also cause you drowsiness. And her drowsiness related problems had indeed escalated a little bit further as well in the later years of her life. So again here, why he was pushing for her to get this diagnosis of mental illness is because then she would have access to not just SSRIs, but a doctor could have very well given her some benzodiazepines as well. And I don't recollect whether my mother had been prescribed benzodiazepines. But all of these, if she had been prescribed, are responsible for her drowsiness, for her health incidences. And for her, the more you are drugged and groggy in your own home, even more harm can be done to you, like how Giselle Pellicot's husband, using these kind of medications, abused her sexually, got other men to abuse her sexually. Some similar things related to my mother's body could have been done to her as well, which eventually led to her part of the reason why she also died in the future. Now, I know that whatever happened to her many years before she died were all slowly responsible for her eventual death, which can happen inadvertently to some patient even if they don't have a antisocial personality caretaking them. But when an antisocial personality is caretaking them, that can get enhanced to a quicker timeline. Meaning, if in that same household there was really a concerned husband who out of true concern, who out of true unawareness continued giving some medication that the patient may not have needed because false diagnosis by a doctor could have happened at that time, or partial diagnosis happened and real interventions needed for treating someone's conditions didn't happen, or inadvertent duplicate therapy happened. All of these things also can cause a patient a health harm. The only difference between deliberate health harm and inadvertent health harm is inadvertent health harm can develop more slowly than a deliberately plotted and planned health harm. These are only the two differences. But sometimes if a deliberately done health harm also unfolds in someone's life, the deliberate health harm can also be a slow calculating thing. And I will post another video about some murder cases or murder accused victims, meaning I believe that the people who have been accused of doing the murder are actually partly innocent or completely innocent, and I will discuss about them in my next video, because this is another area government, social systems, legal systems have to become aware of. And in that incidences, why I'm saying that is associated with some of the topics I introduced in this video. And if people have questions, comments, want more details about any of the topics I'm discussing here, please get in touch with me or drop a comment here. You can get in touch with me via LinkedIn. Right now my Instagram is somehow blocked for some reason, so please get in touch with me via LinkedIn if you want to connect with me about any of these topics. Thank you very much. Have a great day.